Systemic lupus erythematosus is a chronic autoimmune disease characterized by the production of antibodies against self-antigens, leading to inflammation and tissue damage in multiple organs and systems of the body. The exact cause of SLE is unknown. It is believed to involve the combination of genetic, hormonal, environmental, and immunological factors. In susceptible individuals, abnormalities in the immune system result in the loss of self-tolerance, leading to the production of antibodies and the formation of immune complexes. Genetic predisposition. Individuals with a family history of autoimmune diseases, including SLE, have an increased risk of developing the condition due to shared genetics susceptibility factors. Female gender. SLE predominantly affects women of childbearing age with a female to male ratio of approximately 9 to 1. Hormonal influence, particularly estrogen, may play a role in the increased prevalence of SLE among females. Environmental triggers. Exposure to certain environmental factors such as ultraviolet light, infections, medications, and hormonal factors can trigger or exacerbate SLE in susceptible individuals. Race and ethnicity. SLE disproportionately affects individuals of African, Asian, Hispanic, Native American descent compared to Caucasians. Ethnic variations in genetic susceptibility and environmental factors may contribute to a difference in SLE prevalence and severity among various racial and ethnic groups. Major signs and symptoms. Butterfly rash, a characteristic facial rash resembling a butterfly shape over the cheeks and bridge of the nose. The rash may be photosensitive, worsening with sun exposure. It occurs due to immune complex mediated inflammation in the skin, particularly in areas exposed to UV light. Arthritis, symmetrical joint pain, swelling, and stiffness, often involving the small joints of the hands, wrists, and knees. Arthritis in SLE results from immune mediated stenosis and inflammation of the joint lining. Renal involvement, proteinuria, hematuria, hypertension, and renal insufficiency due to immune complex disposition and inflammation in the kidneys. Lupus nephritis can lead to progressive kidney damage and renal failure if left untreated. Fatigue, persistent, overwhelming fatigue that is not relieved by stress or sleep. Fatigue in SLE is multifocal and may result from chronic inflammation, pain, medication side effects, sleep disturbances, and psychological factors. Diagnostic testing. Anti-nuclear antibody test detects the presence of autoantibodies targeting components of the cell nucleus, such as DNA and histones. ANA positively is the hallmark of SLE, although it can also occur in other autoimmune and rheumatic diseases. Complete blood cell count evaluates red blood cell, white blood cell, and platelet counts. Anemia, leukopenia, and thrombocytopenia are common hematological manifestations of SLE due to bone marrow suppression, autoimmune destruction, or sequestration. Renal function test measures serum creatinine, blood, urea nitrogen, and urine protein creatinine ratio to assess kidney function and screen for lupus nephritis. Elevated creatinine and bun levels, along with proteinuria, indicate renal impairment in SLE.